Hi, I'm Michael Herrick with HIPAA for Humans, realistic cybersecurity advice for healthcare. A couple of months ago, the Department of Health and Human Services published a very interesting report summarizing the findings from their recent HIPAA audits. Now, I'm an optimist, so I see this as a classic good news, bad news situation. And I want to talk about the good news that I see in this report. I want to talk about that good news in an upcoming video. In this video, we need to take a maybe uncomfortable look at some of the bad news coming out of HHS regarding HIPAA audits. HIPAA is more than 20 years old, and we're seeing in these HIPAA audits that people still don't get it. People still don't really understand what's expected of them in putting together their HIPAA risk management programs. HHS found that a very small percentage had an adequate risk management program that met the standards. 86% of the covered entities surveyed in these audits were not able to provide the required documentation around their risk assessments and their implementation plans for reducing security risks at their organization. 86%. And a lot of that gap they saw is coming from a lot of confusion about what's expected. When they asked for this documentation, they found that a lot of covered entities were sending in just irrelevant documentation. People were sending in things like their fraud, waste, abuse guidelines or their employee code of conduct. A lot of organizations were sending in HIPAA and security information from one of their vendors, HIPAA information provided by their EHR vendor or provided by one of their data centers. Good HIPAA information, but not relevant to how the organization is protecting PHI apart from that one isolated vendor environment. Some organizations were even sending in HIPAA policy and procedure templates, not the policy and procedure documentation, just templates that they had purchased on the internet and had never bothered to adapt and adopt at their organization. So people are just a little bit at sea. They're really not sure how to even respond to these requests for this kind of documentation. 86% of covered entities are in that boat. Of those organizations that did have good foundational documentation for their risk assessment and other documentation, 94% had failed to follow through on the findings from their risk assessment. They may have identified security risks and improvements that they could make, but they hadn't followed through and actually implemented those improvements. They found a lot of organizations had noted down encryption as a goal for the coming quarter or the coming year, but that encryption had never moved from the stage of good intentions to implementation. Good intentions isn't going to protect you from the hackers that are out there. So people weren't following through and actually implementing the details from their risk assessments, and people weren't keeping them up to date. They mentioned one organization that had a really good risk assessment dated 8 years ago. Things have changed a lot in the last 8 years, and we have to keep up to date. So my question for those of you watching this video, and this is the bad news, do you see yourself in this report? If HHS were to ask you for this documentation, would you even know what to provide? They would ask you for your risk assessment, policies and procedures about how you do a risk assessment, what you look at, who's responsible for it, how often you do a risk assessment. And then they're going to ask for evidence that you've implemented changes at your organization as a result of the findings of your risk assessment. If you were asked for that documentation, would you be able to put your hands on it this afternoon? Would you be able to find that documentation? Would it be up to date? And would you feel confident sending that over? Or would you send it over with a sinking feeling that you're not quite passing muster? That's the bad news. The good news is, well, the bad news is 86% are in that boat. The good news is 86% of us are in that boat. You're not alone. Everybody's still struggling with this, and everybody's trying to catch up with this. And HHS is really pushing us. Guys, it's been 20 years. Let's really get our hands around this. Let's really start understanding what it means to put together a HIPAA risk management program for our organizations. That's what we do at Matterforum, and I'm going to make an upcoming video about how you can, what you should be looking for in your risk management program, what's really going to meet the standards from Health and Human Services for your HIPAA risk assessment. I'm Michael Herrick at Matterforum. Please share our videos with those colleagues of yours who could benefit from free educational information about making a HIPAA risk management program designed for human beings. Thanks for watching, and I'll see you next time.